Good evening and God's blessings to the people of the Virgin Islands. This is your Premier, Andrew A. Foy, and I'm also here joined with His Excellency the Governor and the Minister of Health, Honorable Carl Malone, and Minister of Transportation, Honorable Kairima, and the Minister of Education, members of Cabinet, Honorable Honorable Natalia Whitley, and we also had in Cabinet with us today Honorable Vincent Whitley, who has already returned to the lovely island of Virgin Gorda, one of our sister islands. We just completed a next session of Cabinet. As you know, Cabinet is meeting just about every day to make sure that we stay updated with all the current events of COVID-19 involving the British Virgin Islands. We also meet Cabinet every day to ensure that the decisions that need to be taken to secure the health and the safety and the well-being of the people of the Virgin Islands is taken daily, whether it be remotely or if needs be where we have to meet, but honor the social distancing that we are also preaching, we make sure that we practice them. So today, the 31st, Monday the 31st of March, the Cabinet met and the Cabinet have decided certain measures to be put in place. Of course, you know that the curfew that everyone is currently under, and I must congratulate the people of the Virgin Islands to know that it has been difficult, but I want you to know that all that is being done in your best interest. All that is being done to make sure that under our leadership that we do not lose one life to COVID-19. Currently, we would have known that we had 27 tests that went abroad before and 25 tests that went abroad before, and that gives us a total thus far of 52 persons that were swabbed, and we have 3 confirmed cases that we have stated. But please bear in mind that persons are being tested all the time, and as we get the information, we'll bring it to you, the people of the Virgin Islands. The reason for the curfew, as we had stated before, was to ensure that we reduce and eliminate any community spreading of COVID-19. We have made sure as a cabinet and as your government that measures continue to be put in place in a proactive measure so that you, the people of the Virgin Islands, can be safe. When you look at some of our actions, the preventative measures, including the locking down of the borders, which was very, very, very crucial for us to make sure that we contain COVID-19 from getting into our borders and make sure that whatever may have exist in the territory, that we contain it and make sure that we get it under control. So we also saw that we set up economic task force because that's very important to make sure that we come up with ways that we're going to help small businesses, that we're going to help other businesses, and also how we're going to stand the tide for this economic onslaught that we are seeing worldwide caused by COVID-19. But our first and foremost priority is to make sure that the people of the Virgin Islands is safe. And that's why we have also made sure that we have invested through the kind help of the OECS to invest in the Cuban medical personnel that was worked on by the Ministry of Health, also worked on with the Secretariat by the Premier's office, and also assisted by the Governor's office, in which the Governor, through the UK, have given approval for those personnel to come to be able to assist. Not that something has gone wrong, or we have a number of cases that some persons are saying that we're trying to hide. We will hide nothing dealing with COVID-19. Whatever we know, you, the people, will also know and know in a timely manner. And when those doctors and medical persons from Cuba do come, they'll be quarantined for 14 days to make sure they also go through the measures that have been put in place. But they're here to help and continue to be in a proactive mode. We have seen many other measures where we have stopped the cruise ships to make sure that we reduce the volume of persons coming into our shores before the borders were closed, but eventually they were closed. We have seen where we have purchased equipment that can test for COVID-19 right here on site, and the public health in the UK and our ministry here have also been in steady contact with about 500 more test kits coming in. We have seen also we're investing in possible treatment that we will be saying more of at a later date so that we can continue to be proactive. Of course, the economic relief package will be announced in the not too distant future. But again, I must stress our first priority is making sure that we keep the people of the Virgin Islands safe. We have also seen that in a proactive mode to make sure that despite what we are going through, we keep our eyes on what we are going to, which is to make sure that after COVID-19, we are now further ahead than we were before. And with that, we had the intra-regional trade and commerce symposium, which was held yesterday with most of the territories, countries in the Caribbean region. These all have been put in place to deal with what's happening now and still looking ahead. But we also see that we have 3 confirmed cases, but we also know that we have 143 persons in quarantine. And we want to let the public know that there were concerns about some of them, whether they were respecting the measures being put in place for them to be quarantined. We heard stories and also saw persons giving us pictures of some persons who are not respecting this need to make sure that they stay isolated for the time frame that they were given. So today in Cabinet, we addressed that. Cabinet made passed measures to be put in place to ensure that those 143 persons are all properly accounted for at any time of the day, 24 hours, 7 days a week, until their quarantine time is up. This is very important, and I want to speak to the hearts of my people in the Virgin Islands, especially those that quarantine. You now will not be able to just quarantine yourself as in certain cases, but now you'll have measures in place to make sure that there's security there, ensuring that you're quarantined. Persons have to understand that this coronavirus, COVID-19, is no respecter of persons. And when you violate the quarantine, you are violating other persons' right to live. So I want to speak to the 143 persons to make sure that you understand that your role of making sure that you stay quarantined is important, but now we have to put the measures in place, and Cabinet today has passed measures to put in place to ensure that we can tell the public that we can account for every single person that is quarantined and they're not mixing and mingling through the society. Why is this important? Our decisions today was based on making sure that we can account for all cases or any persons that have been coming in contact with persons with cases or might have come in contact with persons who have been confirmed cases or other high-risk areas, so that we can limit and eliminate the chances of it spreading through the community. The virus does not carry around itself. People carry it, as you rightfully have heard many times. And the less that we congregate, the less that we do social gathering is very good when we do that less right now, because the virus have a small chance, if not impossible, to be transferred to anyone else. We want to make sure that we contain this virus. But the only way we can do that is when the people of the Virgin Islands continue to listen to the measures. We made decisions today based on making sure that we can account for that 143 persons, because we realize that the curfew is coming to an end on the 2nd of April at 6 a.m. And we realize that other measures have to be put in place. So Cabinet today, with all of us working together in one accord for the people of the Virgin Islands, made a decision that a new curfew order will be put in place. And the governor, as he comes, will even be able to ventilate more about it to you. But a new curfew will be put in place starting from on Thursday, 2nd April at 6 a.m. and it will be going for 14 days. Now, I know anyone listening will be saying, if you are as low on food as I am in my home, 14 days, well, how are we going to eat? Well, Cabinet also have passed some measures to ensure that persons from all diaspora of the Virgin Islands will have an opportunity to get out there to shop, to do banking, to do certain other things where certain essential services through the hard curfew that will be put in place will be allowed to open for certain hours. Those details are being worked out as we speak. We had a very good meeting, conference call with all the retailers, most of the retailers in the territory, and wholesalers and many other business persons along the lines of the essential services that will be allowed to open, so that we can get better feedback from them. And tomorrow at 9 a.m. we're continuing that meeting so that we can come back to you tomorrow to tell you how you will be able to shop, how you'll be able to get to the banks, and then what you'll do afterwards. It is not a free time, those who will be allowed at different times, in terms of it's just an opening, being allowed during the curfew to do the necessary things that you have to do, whether it be to pick up medication, to go to the pharmacy, whether to go to the doctor, to go and do some banking, to make sure that you can get food, because you need to shop for this food in the days that will be allowed, because it's going to be 14 days this new curfew will be put in place. So when you shop this time, please shop in the mindset that it will be 14 days that you're shopping for you and your family. And we ask persons to, during this curfew with the 14 days, is to be mindful what all you will put in place. Just like how you plan for your job and your job plans work for you, plan for your family. What you want to do with a storytelling one day, learning how to cook different dishes for your children the next day, listening to our old-time stories from our seniors on the third day, whatever it may be, make sure that you put it in place. But most of all, make sure that you pray. We only can beat COVID-19 through prayer, despite all what the government has done, is doing, or will do. The only weapon that we have against this is prayer. And prayer has been that of our forefathers that have built this territory on prayer. Now we have to pray and stick in Psalms 91, because he that dwelleth in the secret place of the Most High, is the one you have to put your trust in. I didn't come with a prepared script today because I want to speak to the hearts of the people of the Virgin Islands, to let them to know that we're not going to be in this forever. But in order for us to get out of this together, alive, we must respect the measures that have been put in place. It hurts my heart to know that persons are still trying to sneak out and break the curfew, and that 8 persons had to be arrested. We're asking persons to understand that we're not doing this to put you in a cage. We're not doing this to end your life. We're doing this to make sure that we can give life by keeping you COVID-19 coronavirus free. So with this and these measures in place, I want to commend all our frontline staff, all the public officers, the Minister of Health and his team, the Permanent Secretary, Mrs. Pushona Smith-Davies, and all of those in the Health Emergency Center that is working. There's so many people working, our customs officers, or police officers, so many frontline staff, the Water and Sewage Department, so many frontline staff that are helping us out through the middle of this curfew, through the middle of this health pandemic. And nothing that is happening here is unique to us alone. The whole world is facing it. We have done a heroic job of trying to contain COVID-19, and it shows the power of our people once we work together. Once we decide that we are going to walk in oneness of purpose, praising our God, asking Him for faith, asking Him for patience, asking Him for wisdom, asking Him to help us through this time. And I ask you to make sure that you continue to pray, because it's important. Stick Psalm 91 up over your doorposts, so that we'll be like the Israelites with the blood over their doorposts, that He'll pass over us. And we know that the Bible said that what was is, what is was, and what was will be again. So if we want to know where we are, look at the Bible for a reference point, so that we can see and educate our children and educate ourselves on how we will get out of this wilderness. This is very important for us, because our mental stability is important during these curfews, especially with a 14-day one coming up. But you make sure that you take advantage of the time that you will be allowed to go to shop. We're going to start in a rotation period, but what kind of rotation period it will be, that will be announced tomorrow when we come back to you, the people. We want to make sure you, the people, understand that all that is being done is for your safety, our safety. All that is being done is to make sure that when the book is written on COVID-19, they can look throughout the world and say the hand of the Lord was on the British Virgin Islands and the people, because we were true to Him. That's the only reason thus far we have been able to contain this virus in the way that we have contained it. And I thank all those persons who are out there policing themselves and policing others. I thank every one of you who have posted on Facebook for persons who should have been quarantined or out. They need to make sure that they understand that they're putting us in danger. So I thank you, and we have watched, listened to all that you have said. We have read all your posts, so that we can make sure that we don't become bitter by what you have posted, but that we become better. And we welcome your ideas. Tomorrow we have to make a decision on how we will go about allowing persons out from District 1 to 9, how we will let you out to be able to shop, do banking, out of your homes to do essential services. So tonight I welcome you to WhatsApp all of us, email all of us, give us your ideas. We have ideas of our own, but it must be done in such a way that we have controlled crowds. We have also encouraged the supermarkets to make sure that they don't have any more than 20 persons at a time in the supermarket, and then make sure that they sanitize the baskets, sanitize the cats, and make sure that all the social distancing and social gathering measures that have been put in place by the government is respected. We want to make sure that there are no lines out of the supermarket where persons are not standing at least 6 feet between each other. But most of the biggest supermarkets have said that they're going to put a system in place where you can stay in your car until they give you a number system and then you can come in. This is remarkable by our business people. And I want to say too, we are encouraging persons who have masks when you come out to use them. But we're encouraging only one person from a family come to shop. Please don't bring the children. Don't bring the whole family out to shop. Just one person out of every family, that when your time comes and you're allowed to go to do shopping or go to do whatever you have to do by the bank, allow one person per family. That is very important also to help us to control the crowds and help us to control what it is we are trying to do so that we can meet the people's need while saving our people's lives. So today, as your Premier, I stand here saying thank you to all the members of Cabinet, and I'm pleased at the behavior of my people. There'll always be one or two, but I'm pleased with the majority of the behavior of the people of the Virgin Islands. And we have to go 14 days longer. But rest assured, you will have the chance to get some food, get some cash, get a little walkabout, but get right back inside, because it's not going to be an open time. It's just going to be an exception made for you to get the necessities you need and to get right back home. So may the peace of the Lord be with you. And now I'll ask the Governor to come and say a few words to the people of the Virgin Islands.
Thank you very much, Brother. Good evening to everyone in the British Virgin Islands. And as the Premier has said, I just want to also myself reiterate my thanks to everybody in this territory for continuing to observe the curfew. What this territory has done over the last days has been quite astonishing. The measures are unprecedented, but also your reaction has been astonishing. And that has helped us to help break the chain of this disease. I will set out a bit more some of those measures that the Premier has talked about that Cabinet have decided upon today. But as the Premier said, there's also areas we are still working on, and we will be honest and open with you and update you as soon as Cabinet have made those decisions. As you have heard, we now have 3 confirmed cases of the coronavirus in the territory. These are all cases of people who have recently travelled. We still do not have confirmation of community transmission and need to do everything possible to keep it that way. As you are all acutely aware, an around-the-clock curfew has been in place since Friday the 28th of March and is due to end, as you all know, on Thursday, this Thursday, at 6 o'clock in the morning. As soon as the territory had its first case, we agreed at Cabinet that putting this in place was the best way to minimise the risk of community transmission. We know it has been difficult. We know that people have found it challenging not to be able to take their rubbish out, their garbage out, and keeping themselves or their children indoors. So, as the Premier has said, I want to repeat my thanks to all of you, the vast, vast, vast majority of you, for complying. We are all in this together. This is a joint effort with all of us playing a part. And as the Premier said, these measures have been driven by simply one motivation: to protect you and to protect the overall population of the territory. These measures and your cooperation have made a real difference. As you've already heard, these measures have not been taken lightly and have been based on scientific advice, calling on the expertise of our own medical professionals, those in Public Health England, and those in the region and globally. As the Premier said, Cabinet today has put in place enhanced plans for surveillance and monitoring of people subject to quarantine. Currently, that number stands at 143 people. They will, under new legislation, be mandated to stay at home for the full quarantine period. The Deputy Governor and the HEOC are working up arrangements where they will be monitored to ensure their compliance of staying at home during that full period. And under new legislation, those under quarantine could face penalties if they leave their home or their place of quarantine. I know the vast majority, again, of people under quarantine have been complying, but those who don't comply put all of us at risk. This is vital to protect the territory as a whole. Cabinet understands that an around-the-clock curfew is incredibly difficult for all of us and brings with it different challenges. We also recognise that we must continue to minimise interaction with people. We have sought a solution which not only protects our people, but will allow people to undertake essential business. Going forward, from Thursday morning, for a period of 14 days in the first instance, a new regime will be in place. From Thursday the 2nd of April at 6 o'clock in the morning until Thursday the 16th of April, there will be a new curfew regime. I will read out what Cabinet has decided. Firstly, that under the Curfew Act 2017, a curfew will be imposed from 6:01 a.m. on Thursday the 2nd of April to 6 p.m. on the 16th of April, with the exception of essential workers. That under the Curfew Act 2017, an absolute curfew will be imposed from 6 p.m. to 6 a.m. That under the Curfew Act 2017, a limited and managed curfew will be imposed from 6 a.m. to 6 p.m. during this period, subject to the following conditions. This will allow limited basic and essential services, such as pharmacies, supermarkets, banks, gas stations, private medical facilities, fisher folks, farmers, and a limited list of approved wholesale distributors, who will be allowed to open and be encouraged to offer online shopping for curbside and home delivery. Businesses that are allowed to open during this next curfew period are mandated to maintain the protocols for social distancing and implement sanitisation measures. Nobody, no one, under mandatory quarantine will be allowed to leave his or her home or place of quarantine during this period, and measures will be implemented as to how they will receive essential supplies at home. Those persons in vulnerable categories must also remain at home and receive their essential and basic supplies through home deliveries. Cabinet also decided that household curbside garbage collection will be implemented on designated days in accordance with a territory-wide schedule, which will be, further details will be following from the Minister and from the Waste Management Department in the Ministry of Health and Social Development. Cabinet also decided that a new approach for the issuance of curfew passes will be implemented. What this means is that for the 14 days from this Thursday, there will be a curfew in place. From 6 p.m. to 6 a.m., so overnight, night times, it will be an absolute curfew. Everyone, apart from those in essential services, should be at night time in their homes. During the daytime, 6 a.m. to 6 p.m., a limited and managed curfew will be in place to allow access to key supplies. On Thursday at 6 a.m., the transition to the new daytime curfew will begin and will continue to 6 p.m. that evening. From 6 p.m. until 6 a.m. the following day, the Territory will revert to the current hard curfew, the absolute conditions, where no one must leave their homes. This pattern of daily, limited, managed curfew and an absolute hard nighttime curfew will be repeated for a period of 14 days until the measures are reviewed approaching the 16th of April. These new measures will allow all residents limited access during the day to places where they can meet their basic needs. As I said earlier, these locations include supermarkets, pharmacies, gas stations, as well as other approved essential businesses, and we will set out tomorrow further details on those. As the Premier said, though, even though people can go out in those limited circumstances, people must at all times remember the basic rules of social distancing and remain preferably 6 feet apart. Those businesses which are open will be asked to ensure that numbers within their premises are limited so that social distancing can be observed. We will also, as the Premier said, be exploring with the supermarkets and others increased home deliveries and the introduction of curbside pickups. Cabinet tomorrow will be agreeing proposals to stagger access to the shops and services. That means that not everybody in the territory will be able to access services at the same time. We will provide a further update with fuller details tomorrow on those arrangements. I know a key concern for many over this last period has been garbage collection. As I said, the territory-wide curbside garbage collection will be taken forward and further details will be set out. The introduction of a daytime limited and managed curfew does not mean in any way we are out of the woods. Life will not be turning back to normal yet, and you will be expected to remain at home unless you are venturing out for central business or unless you are an essential worker on the way to or from your place of work. Those in vulnerable categories should not go out, and home delivery options really are what must be followed. The important thing, though, for all of us is to continue to stay at home as much as we can. Scientific research has highlighted that implemented social distancing effectively can lead to a reduction in the chance of infection by 85%. This is so significant, particularly for our small communities. These measures, and I know the Minister of Health may say more on this, these measures are leading to us reducing the risk of transmission by the thousands. The move to a managed and limited daytime curfew will allow us to move around during the daytime in a restricted manner that meets our essential needs, but I repeat, only, please, when essential and when allowed. The key is to stay at home as much as possible and keep distance to break the chain of this disease. If we want to beat this virus and return to normal life as quickly as possible, it must not be taken, this limited and managed curfew, it must not be taken as a license to gather or ignore Covid-19 coronavirus prevention or hygiene measures. As I said from the Cabinet decisions, we will also be reviewing the system of curfew passes. Following the imposition of the curfew last Friday, the number of passes has far outweighed expectations. We have therefore reviewed the policy for issuing passes and will be undertaking a validation process to ensure that only those who have essential roles will have passes issued. As a reminder, curfew passes must only be issued when individuals are undertaking essential duties or travelling to or from their workplace for those essential duties. Pass holders are otherwise expected to uphold the restrictions of the current curfew in line with all others. These are difficult times, and the truth is they will likely remain difficult for some time to come. We know one way this crisis is different is that we have no idea how long it will last. We have no idea who the virus will infect. But we do know we can take measures ourselves to minimise the chances that it goes on longer than it needs to or infects more people than it needs to. And those choices are ones that Cabinet can make, but those choices are ones that you need to make about staying at home, following the advice and following the guidelines and also the rules that will come out through this next stage. We must not focus or fret on a particular date by which we expect the world or even ourselves to be through the worst. We must ensure we take every effort to follow these sensible steps to protect each other and those we love, and also hold on to the fact and stay positive that we know this will pass. As I said, Cabinet will provide further details on the above arrangements tomorrow in advance of the changes on Thursday. Finally, once again, can I thank all in our public services, our emergency services, and our statutory bodies. Can I once again, though, thank all of you and all in this territory for assisting in the fight against this virus. We are all in it together, and we will all get through it together. Thank you, stay healthy, and may God bless this fantastic territory. Thank you. The Minister of Health.
Good evening to everyone. First, I'd like to say a word of gratitude to the hard-working civil servants and professionals who have led us through this period. And we cannot go without thanking the Joint Information Team for the level of communication that they have had throughout this process. According to the Health Emergency Operations Center, national action plans against COVID-19 pandemic, the territory is now at the Operation Action, Stamp It Out Red Alert, which was activated when the first laboratory confirmed human case in the British Virgin Islands was identified. The objective of this level is to rapidly contain, spread, and prevent transmission within the community, especially to vulnerable groups. During this phase, activities will focus on increasing surveillance and reporting from senatorial sites, preparing and supporting health system needs, managing initial cases, identifying and characterizing the nature of the disease within the BVI context, providing information to support best practice healthcare, and to empower the community, the responders, to manage their own risk of exposure, and to supporting effective governance. In order to limit the active spread of infectious disease, public health prevention and control measures, non-pharmaceutical measures like social distancing, epidemic lockdowns, and quarantine management must be implemented early in the outbreak phase and to a substantial extent in order to be effective. Specific measures implemented must be timely, but comprehensive and rigorous on a national scale, encompassing the entire affected community or country in order to be effective. Countries like the British Virgin Islands, with low numbers of confirmed COVID-19 cases, should operate on the assumption that there may be a substantial amount of transmission in the territory that remains undetected. Underpinning the recommendations is the need to keep the number of infections across the territory low while the government ramps up its healthcare system. Globally and regionally, evidence shows that when the virus is left unchecked, it infects people at an exponential rate. Each sick person can pass on to 2 to 3 others, who then spread it to the next 2 to 3 persons, such that a single case quickly leads to hundreds. This trend has been seen in the Caribbean, especially in neighboring islands. Aggressively seeking out and identifying people with symptoms, testing them, isolating those who have the virus, and tracking their contacts is most effective when countries have few cases. Social distancing dramatically slows the virus speed by reducing opportunities for people to infect others in face-to-face circumstances. Waiting to implement social distancing measure after the disease is out of control in the community translates into having the measure in place for longer periods to be successful in curtailing the upward spiral of new infections. These prolonged restrictions can lead to higher deaths. Analysis of how the virus spreads suggests that as soon as a freeze on movement is lifted, cases could rapidly rise. This is the reason why we are looking at a new regime of curfew. To investigate the impact on the territory, the epidemiology unit modeled the possible epidemic size. It was estimated that in 12 to 15 days, 10.5 to 12% of the population would be affected by COVID-19 if it goes unchecked. This equates to close to 3,750 persons if it goes unchecked, if the measures properly are not taken, are not adhered to. If left unchecked, calculations show that in 90 days, 89.8% of the population would be infected. When the possible impact of interventions such as social distancing was implemented for 15 days in the model, with the estimation of 95% decreased in social contact between persons, a notable reduction of approximately 85% was seen. I'll repeat. When the possible impact of interventions such social distancing was implemented for 15 days in the model, with the assumption of estimation of 95% decrease in social contact between persons, a notable reduction of approximately 85% was seen. This reduction could be a consequence of those persons infected within the period 9 to 23rd March 2020, having recovered or out of the infectious stage with only the second or in some cases third generation remaining affected or infected. Extension of the territorial shutdown would facilitate recovery in a percentage of those second and tertiary contacts, reducing the number of still infected contacts circulating in the population when the shutdown is lifted. Social distancing measures should still be considered thereafter, such as curfews and flexible or staggered work times, to further reduce the number of daily susceptible persons to prevent a resurgence of COVID-19 transmission in the population. Both the Premier and the Governor have outlined the measures and the rationale behind this extended period with measures to be taken. We urge you, each of you, to do your part. We can get through this together if each of us do our part. I thank you very much.